the amazing Dr. Stewart. She is a sports medicine physician, and I'm so excited to share with you the awesome things she's doing. So, to kick us off, Dr. Stewart, share a little bit about yourself, what you do, where you are, and where you trained.
Okay, good morning, everybody. My name is Dr. Janiece Stewart. I am here in St. Louis, Missouri, and I am a sports medicine physician here. So I actually originally trained in internal medicine and pediatrics and then did a sports medicine fellowship. So you would find most people like me called a primary care sports medicine doctor. We basically take care of any non-surgical orthopedic problems that you may have.
Awesome. So non-surgical orthopedic options. That is a mouthful. So when I hear sports, I think sports players, athletes. Who is your typical patient?
I would say almost anybody that has an issue with any bone, muscle, joint. So like if you have shoulder pain, knee pain, ankle pain, you sprain your ankle, anything like that, that would be my typical patient. And I see everybody, I see young kids to the elderly. So there's really nobody that I don't see. It just depends on whether you need surgery or not.
Awesome. So you mentioned young kids, and I know sports injuries, we often think about, like you said, my wrist hurt, my elbow hurts, my arm hurts. But what are some non-joint pain issues that you may see as a sports medicine doctor?
So I often see ankle sprains, which doesn't necessarily involve the joint. That usually involves ligaments. So you sprain or tear a ligament. I do want to kind of make a differentiation between ligament and tendon. We get a lot of questions about that. Ligaments attach bone to bone versus tendons attach your muscle to the bone. So like your quad muscle on the front of your thigh actually turns into a tendon and attaches to your kneecap. So we would call that a tendon versus a ligament that attaches one bone to another bone.
What would be an example of a ligament or a common ligament injury?
Most people that I have in the office come in for ACL tears.
Okay. So that's a good example. What about things like concussions? I saw in the news recently this guy, unfortunately, passed away, a younger player, I think Marius, it was a couple years ago, from epilepsy, but they thought that his epilepsy might be related to concussions. Is that something you treat?
Yes, definitely. And it can be concussion from sports or even just falling. Here in the Midwest, we get ice and snow. So some people slip and fall and hit their heads, and that can be a concussion as well.
Okay. Well, good to know. It doesn't always have to be an injury that came directly from a sport. So in terms of the top 5 things that you see and treat, you've already mentioned a few things to us. What would be like the top 5 things that you see and treat as a sports medicine doctor?
I would say the first thing is arthritis, even though that's not necessarily sport related. It can be. We see a lot of professional athletes or athletes that have played sports from a young child to, master athlete. They can get arthritis too, but just the average everyday person over time, as you age, can get arthritis. So I would say that's the number one thing that I see. Then next, with related to sports, a lot of it's rotator cuff injuries, whether it's a tear or a sprain, a lot of tennis elbow or golfer's elbow, and knee injuries. It could be a sprained ligament, or sometimes I see dislocations of the kneecap as well. And then ankle sprains, very common.
Awesome. So I'm going to bring up an issue that I don't think is very common, but I think it's important to touch on. Are there any hip injuries related to sports that may not be as common? People may not realize something may be going on.
Yeah, I get a lot of patients coming in my office saying their hip is dislocating. And I'm like, wait, whoa, how in the world does that happen? Because that actually takes a lot of force to dislocate a hip. So you were either in a car accident or fell from a height or something and dislocated your hip. most commonly what people feel is popping of either their IT band, their iliotibial band, which is on the outside of the hip, or the hip flexor, which is a little deeper muscle, but that can actually pop back and forth over the pelvis and make it feel like your hip is dislocating, but it's really not.
It was me. I was that patient. Okay. When I would run track and I was like, is my hip coming out of place? Like, what is happening to me?
Yes. I'm like, time out.
And it would be loud. It was embarrassing.
Yes, it is. It is
what
loud.
exactly is going on? So obviously I've gotten to know you and know what a great doctor you are. But for someone who's never met Dr. Stewart, what sets you apart? What's your kind of philosophy when it comes to patient care?
That's a great question, because I get a lot of patients thanking me for my time and my kindness when they come in. And I went into medicine to help people. People come into my office in pain, and pain can make you cranky. So I really sit down with a patient and talk with them to find out a little bit about their past. They kind of look at me like, what? You're not my family doctor. But I feel like the more I get to know the patient, their past and what they've been through, their family issues, what's going on at the time, all of these things, believe it or not, can be contributing to the pain, but all they're focused on is the area that hurts. So I really try to get to know them, and then we kind of talk about what's going on with their issue, and then we decide together what we're going to do about it. I make my recommendations. I see what exactly it is that they want to do in terms of the recommendations and what they don't want to do. And then as a team together, we treat it.
Awesome. I love that team-based approach to medicine.
Yeah.
As family medicine doctors, we train with many different specialists. And I remember when I would rotate with orthopedic surgeons, and they would be in and out of the room like a flash. And I remember once the patient was sitting there and I'm standing at the door and they're like, are they coming back? I'm like, no. Like, it's over. And so just hearing you say that you actually spend that extra time, I know for sure that patients will appreciate that. So while I mentioned orthopedic surgeons, what's the difference? Because for me, when a patient comes to me with joint pain, they kind of have this idea that they need to go see a surgeon. And then I have to try to like delicately explain to them, hey, if you don't want surgery, this might not be the best place for you to go. So how do you differentiate when a person needs to see an orthopedic surgeon versus someone like you, a sports medicine doctor?
Yeah, I would say that's the biggest thing, is if you need surgery or you don't. And honestly, the way medicine is these days with hospital systems, you may schedule an appointment with an orthopedic doctor's office, but when you go in, you may not necessarily see the orthopedic doctor. You may see a physician assistant or nurse practitioner. And that's because the surgeon wants to be in the OR. They want to see the patients that need surgery. And so people like myself can almost kind of weed that out. Or if somebody doesn't want surgery, we can treat them without having to send them to the orthopedic surgeon. So, if it's something that you're concerned about, if you don't want to have surgery, or you're concerned about possibly needing surgery, I can help figure that out. I can kind of weed through whether you need surgery or not, try some different treatments before actually sending you to surgery. So that would be the biggest difference, is whether you need surgery or don't need surgery.
Okay. And then you touched on treatment options. I think it's important, if possible, if we could talk a little bit about that, because again, I, am the first person most people see and they're like, I'm in pain, give me my hydrocodone. And I'm like, no. So, what are options that can help people not have to take a pill every single day, which obviously can damage their kidneys, can damage their liver, and not even realizing that there are other things they may be able to do?
Yeah, a lot of it, I would say, is like what your mom used to tell you to do: resting, ice, heat, elevating it, especially if it's an acute injury that's just happened and you have swelling. All of those things can help decrease the pain. And believe it or not, swelling just by itself can cause pain. Joints don't like extra fluid in there. So when you have extra fluid that's irritating it, it causes pain. And just decreasing that with ice and anti-inflammatory medicine over the counter is usually what we start with. Ibuprofen or Aleve would be just fine. And then if those things don't help, then there's other options like physical therapy, some laser therapy, some more advanced techniques where we can help loosen up the muscles so they're not so tight, and loosen up the tendons so they're not so tight. And that can help decrease the pain as well.
When are injections indicated in general? I'm sure every person's different. Like, is there a period of time, if you've tried all of those things, where they need injections, and do you do injections?
Yeah, so I do injections. I try to leave that until later down the line in treatment. I usually try to start with some rests, ice, anti-inflammatory medicines, physical therapy. And then if that's not working, then we try steroid injections. There are some more specific injections that we can do for arthritis that don't involve steroids. I do those as well. If I was to do an injection immediately, it's usually because there's a big swollen joint, it's got a lot of fluid in it, and it's really causing problems with the patient, whether it's walking or lifting their shoulder, things like that. Then I will do an injection immediately to give them some relief. But then I do follow that up with physical therapy too.
Yeah, I think the only thing more relieving than popping a pimple is drawing fluid out of a joint.
It's funny you mentioned the orthopedic surgeon earlier, and that's why I went to med school. I wanted to be a surgeon. And then when I got in there, I was like, oh, I hate this.
President of the Orthopedic Society over here, passed out in the OR. I was like, okay, new options.
Yes, but I still liked to do procedures. So that's when I discovered sports medicine.
Likewise. We're already at 12 minutes. The time is flying by, and we know, guys, that your attention span is just not that great. So we're going to go ahead and wrap up. Let them know where they can find you, how they can book an appointment with you if they're interested.
Sure. You can find me on Facebook and Instagram at Holistic Sports Medicine. You can also go to my website, drjaniecestewart.com, which you can actually book an appointment right there on the website as well. You can call me at 314-257-0060. And then you can also find me on LinkedIn and YouTube as Dr. Janiece Stewart.
Awesome. And Dr. Stewart will be offering Facebook Lives with other topics. So this was just an intro. If there's a specific topic that you would love to hear her talk about, something that you've dealt with, something that's bothering you, please go ahead and drop that in the comments so we can have ideas for future topics. And if your kid is in the St. Louis area in a sports league and you need a doctor to come out and talk to the team or talk to the parents, I'm sure Dr. Stewart might be available. And what other areas do you cover? Because I keep saying St. Louis, but I know it's bigger than that.
Yeah, I would say the Metro East. So St. Louis actually borders Illinois. So I do see patients from Illinois and kind of the surrounding St. Louis area. So we just call it the St. Louis Metro East area.
Awesome. And I know a lot of my followers are in Texas. I am working on getting her to get a Texas license so that I can refer to her also, because a lot of times people just want a second opinion and you want a doctor you trust. So telemedicine would be a great option for that. Thank you so much, Dr. Stewart, for being here with us today. I really enjoyed talking to you. Anything else you want to share before we wrap up?
No, that's it. Thanks for having me.
All right. Thank you. See you all later. Bye-bye. Like, subscribe, and share if you enjoyed the content.